Welcome to our virtual public forum on responsible gun laws and policies for Wisconsin, presented by the League of Women Voters of Wisconsin on Dane County. I am Carol Colby, your forum moderator and a member and volunteer with the League of Women Voters. My career was as a broadcast journalist, and I still remain active in ways I can continue to make a contribution. And this webinar is certainly one such occasion. At this time, I would like to invite League member Ann Lacey to read the League of Women Voters of Dane County Land Acknowledgement Statement. Ann?
So this is the League of Women Voters of Dane County Land Acknowledgement Statement. League formation began more than a century ago in 1920 with women's suffrage, but nearly 2 centuries ago, even prior to the 1848 creation of the state of Wisconsin, an 1832 treaty forced the Ho-Chunk to cede their territory of Dejope, Four Lakes. Both the federal and state governments repeatedly but unsuccessfully sought to forcibly remove the Ho-Chunk from Wisconsin. Truth and acknowledgement are critical to building mutual respect and connections across all barriers of heritage and difference. We continue this effort to acknowledge what has been buried by honoring the truth. In Dane County, we are all standing on the stolen ancestral lands of the Ho-Chunk people. We pay respect to their elders past, present, and future. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us together today. The League of Women Voters of Dane County is grateful for the past, present, and future guidance of Wisconsin's Native nations.
Thank you, Ann. And for those of you who may have missed taking the gun quiz prior to this forum, a link to it is in the chat, and you'll find the quiz very enlightening. Full disclosure, I did not get 100 on it. You'll also find links in the chat to the League website, the dates and times of the discussion units, and the resource guide as follow-ups to this webinar. Before I introduce tonight's presenters, allow me to share a few highlights about the League of Women Voters. The League was established in 1920 and formed from the movement that secured the right for women to vote. At the time, it was referred to as a mighty political experiment. And since its inception, the League of Women Voters has always been a nonpartisan civic organization that has remained true to its basic premise to make democracy work for all citizens. The League strives to engage all Americans in the decisions that impact their lives. The League does not endorse candidates, but influences public policy through both education and advocacy. This webinar is one such example. Members of the League of Women Voters have many opportunities to actively participate. These are listed on the League's websites for Dane County and Wisconsin. You will find Know Your Candidates interviews and information on the League's position on current policies and issues of importance to voters. You are encouraged to share your ideas of interest by filling out the program survey, which is due March 9th. Members are also invited to participate in a League of Women Voters national study on the federal judiciary, which will be held on Zoom on March 22nd. Registration and study materials are available in your e-news or the March 3rd email. And not a League member? Well, the website have information on how to join the League as well. The next major League event in Dane County is the Lively Issues Luncheon on April 26th. It is featuring Mary Beth Collins of UW's Center for Community and Nonprofit Studies. She will speak on the status of civic health in Wisconsin, a critically important topic. So mark your calendars and register soon. First and foremost, the League of Women Voters encourages everyone to vote. The vote is your voice in the political process, which brings me to Tuesday, April 1st, the next election in Wisconsin. On the ballot is your right to vote for a Wisconsin Supreme Court Justice, the state superintendent of public instruction, and another proposed amendment to the state constitution, as well as local candidates. A link to the League of Women Voters of Wisconsin's Vote No to the proposed amendment is in the chat. So don't miss this opportunity to have your voice heard on April 1st. Go to Vote 411 for voter registration and candidate information. And now on to our program, Responsible Gun Laws and Policies for Wisconsin. We begin with an overview of Wisconsin gun laws, policies, and their relative effectiveness on gun violence. Our first segment will feature two speakers, Tara Weens and Nicholas Medley. Tara Weens is the public health analyst at the Violence Policy Center. Tara conducts research on the public health impact of gun violence, analyzing public health and crime data to assess the effect of firearms violence on specific populations and general morbidity and mortality in the United States. Tara authored the Gun Death in Wisconsin report, which was a collaboration between the Violence Policy Center and WAVE, the Wisconsin Anti-Violence Effort Educational Fund. Nicholas Matuszewski is an attorney and advocate for gun violence prevention. He serves as Associate Executive Director of the WAVE Educational Fund, Wisconsin's oldest and largest gun violence prevention organization. And he leads the Wisconsin Community Violence Intervention Coalition and the Wisconsin Gun Violence Prevention Coalition. A William and Mary Law School graduate, Nick is committed to creating a safer, equitable future for all. Welcome, Tara and Nick.
Hi, thank you, Carol. I'm going to go ahead and start sharing my screen. So like Carol mentioned, my name is Tara Weens. I'm the public health analyst at the Violence Policy Center. And I will be presenting today about findings of the Gun Death in Wisconsin report. This study was published in a collaboration between the Violence Policy Center and the WAVE Educational Fund. And I appreciate the opportunity to be here this evening presenting about it. So I'll start very briefly with an overview of the presentation. I like to start presentations with just talking generally about firearm death in Wisconsin. Then we'll get into the specifics of homicide, suicide in the state, and then summarize key findings from the report. So when you're talking about gun death in Wisconsin, this report published data for the year 2022. That was the most recently available and complete data that was available at the time this report was published, which was in the fall of 2024. In 2022, guns claimed the lives of 830 Wisconsin residents. This included 529 firearm suicides, 277 firearm homicides, and less than 10 unintentional firearm deaths. Firearms were used in 57% of all suicides in Wisconsin in 2022, and firearms were used in 85% of all homicides in Wisconsin in 2022. This slide is showing rates of firearm deaths in Wisconsin as compared to rates of motor vehicle crash deaths in the state. So you can see that generally, since the year 2002, the rate of deaths due to motor vehicle crashes, depicted by the reddish-orange line here on this graph, has decreased, while the firearm death rate has generally been increasing over the last 2 decades. You can see that since 2020, the firearm death rate has outpaced motor vehicle deaths in the state, which is pretty shocking when you consider an average person's daily exposure to motor vehicles as compared to a person's exposure to firearms. This graph is showing rates of firearm deaths in Wisconsin over the last 2 decades. This blue line here is showing firearm suicide rates. And as you can see, rates have been increasing in recent years from 5.8 per 100,000 in 2014 to 8.4 per 100,000 in 2022. We'll now add a line for firearm homicide rates to the graph. This is shown in the orange line. Firearm homicide deaths have been increasing a little bit more drastically than firearm suicide deaths, from 2.8 per 100,000 in 2019 to 5.4 per 100,000 in 2021. And then the firearm homicide death rate did decrease in 2022 to 5.1 per 100,000. Taking a closer look at suicide in Wisconsin, we wanted to see how Wisconsin compares to other Great Lakes states regarding firearm suicide rates. Wisconsin has the second highest firearm suicide rate out of other Great Lakes states and is surpassed only by Indiana. So the rate of firearm suicides in Indiana is 9.5, while Wisconsin is 8.4. And again, this is 2022 data. We wanted to see how firearm suicide impacted different racial and ethnic populations in Wisconsin. So this graph is showing firearm suicide death rates for white, non-Hispanic Wisconsin residents. They're depicted here in the red-orange line. The rates for Black non-Hispanic Wisconsin residents are depicted in the dark blue line, and rates for the Hispanic population in Wisconsin is depicted in the green line. So you can see that though the white population in Wisconsin has historically had the highest rate of suicide by firearm in the state, the Black population surpassed this disturbing metric in 2022. Between 2018 and 2022, the firearm suicide rate among Black Wisconsin residents more than tripled. It was 3 in 2018, and it went all the way up to 9.4 per 100,000 in 2022. So this is a really drastic increase in this particular population. We also wanted to look at firearm suicide and how it may differ by geography in the state. The blue line on the graph is showing the firearm suicide rate in urban areas of Wisconsin. It's again increasing, as you can see on the graph, from a rate of 5.9 per 100,000 in 2019 to a rate of 7.4 in 2022. We'll add the line for rural firearm suicide rates, depicted here in the orange line. Rural firearm suicide rates have increased even more drastically than those of the urban areas. They increased from 8.2 in 2020 to 11.4 in 2022. This was a pretty big jump. Now looking at homicide in the state. This graph is not showing rates. It's actually showing the percentage of homicides that are due to firearms over the years. And the percentage of homicides that are committed with firearms is increasing. It's increased from 68% in 2019 to 85% in 2022. Whenever we talk about firearm homicide, we have to acknowledge that there are quite significant racial disparities that exist, not only in Wisconsin, but nationwide. Looking specifically at Wisconsin, in 2022, an estimated 6.3% of the Wisconsin population identified as Black. However, just over a quarter of all firearm homicides had Black victims in the state this year. So this is a really big disparity that's occurring in the state. This graph is showing firearm homicide rates, again, by different racial and ethnic populations in the state. The dark blue line is showing death rates for the Black non-Hispanic population in Wisconsin. The green line is showing rates for the Hispanic population in the state. And the red-orange line is showing the rates for the white non-Hispanic population in Wisconsin. So you can see that though the rates have remained relatively stable for the white non-Hispanic and the Hispanic populations in the state, rates of firearm homicide have more than doubled among the Black population from 23 per 100,000 in 2019 to 56 per 100,000 in 2022. In 2022, Black residents in Wisconsin were almost 70 times more likely to die by firearm homicide compared to white Wisconsin residents for whom the firearm homicide rate was much lower. It was 0.8 per 100,000 that year. The Violence Policy Center publishes an annual Black homicide victimization report, and the most recent report analyzing 2022 data found that Wisconsin had the second highest rate of Black homicide victimization in the United States. Wisconsin was surpassed only by Missouri. So in summary, firearm homicide and firearm suicide have increased in the state in recent years. Black Wisconsin residents have the highest firearm suicide rate, surpassing that of white residents in 2022. Firearm suicide rates have increased more dramatically in rural areas compared to urban, and significant racial disparities exist for firearm homicide in Wisconsin. So if you'd like to view the report, here's a QR code you can scan to access it. It is publicly available, and I'm happy to take questions at the end. Thank you.
Nick, go ahead.
Sure, thanks, Carol. As Carol said in her introduction, my name is Nick Matuszewski. I'm the Associate Executive Director of WAVE Educational Fund. And through that role, I lead the Wisconsin Gun Violence Prevention Coalition, and I co-lead the Wisconsin Community Violence Intervention Coalition. So I'm going to spend a few minutes just talking about the gun laws in Wisconsin and how they compare to some of our Midwest neighbors, and how those policies impact the rates of gun violence. All right, so just first and foremost, why does this matter? Well, we know that gun violence is rising throughout the country, and the Midwest is not immune to that rise in rates of gun violence. And what we see is that a lot of states in the area have strengthened their gun laws, but others have weakened them. And it's really interesting to look and see in these particular states that aren't that different than ours geographically or demographically, what has worked and what hasn't, and what we really need to implement here in Wisconsin. So just a really quick look at the number of gun deaths per year and the increase in those deaths from the different states that border Wisconsin or are one or two states removed. The key thing to look at here isn't the gun deaths, because of course these states all have different numbers of people, their populations vary. So 1,700 gun deaths in Illinois, percentage-wise, isn't that far off from 741 gun deaths per year in Wisconsin. But the thing to look at here is the increase in gun deaths since 2014. You'll see here that amongst all these states, Wisconsin has the unfortunate role of having the largest increase in that time period of 54%. So the question becomes, what have we done or failed to do that's led to that increase? So I'll talk through a little bit about which policies work and which policies we know reduce gun violence, as well as some policies that have been shown to increase gun violence. And if you follow any discussions around the gun violence prevention movement, I'm sure these policies will sound familiar to you, but they're really, really important to know about. And if you, eventually want to advocate for them, it's best to, kind of know which policies are best. So universal background checks are really fantastic at reducing firearm homicides. These policies ensure that every gun sale, whether it's done through a registered gun dealer or through the internet or through, individual parties selling guns, that every gun has to go through a background check. Extreme risk laws, also known as red flag laws. These are really impactful policies that prevent suicides and mass shootings. We've seen in Indiana, for instance, since they've enacted an extreme risk law, their suicide rates have gone down by around 15%. These laws allow for family members, law enforcement, sometime, depending on the way the law is written, healthcare officials or others to go to the courts, civil courts, and ask that firearms be temporarily removed from someone who is deemed to be a threat to themselves or others. CAP laws, also spelled out, would be child access prevention laws, ensure that if someone is in a home where a child is present, they have to secure their firearm safely. And then finally, community violence intervention are programs that are evidence-based. They work in communities that are most impacted by gun violence, and they ensure that individuals who might have reasons to believe that these individuals might be committing acts of violence or be heading towards a life of crime are given the resources they need to avoid that and kind of break out the cycles of violence that exist. These programs have been really successful. They've shown reductions in some cities of upwards of 50 or more % in violence. So it's really, really important that those programs be around and that they're funded. And then at the bottom here, we have a couple policies that are terrible policies. They allow for more guns in public. And what we know is that when there are more guns in a society and in public, the rates of gun violence are going to go way up. So our gun laws versus other states, unfortunately, we lack many of the basic policies that are needed to keep our state safe. We do not have a universal background check. Some of the states around us, Minnesota and Illinois, do. We do not have an extreme risk law. Minnesota, Illinois, Michigan, and Indiana all have those. Indiana, a red state, was actually one of the first states to implement an extreme risk law. Illinois is the only state in the Midwest to have an assault weapons ban. Other states have started to push for policies to do the same, but have not yet been successful in doing that. Minnesota and Illinois both require waiting periods, meaning if you go to purchase a gun, regardless of whether or not you're eligible to do so, you'll have to wait a certain amount of time so that gun is made available. Wisconsin does not have that, and that's something that a lot of people are going to be pushing for this session in the state legislature. And then finally, community violence intervention funding. Minnesota and Illinois have really good funding streams for these programs. Wisconsin has some great programs, but we're lacking sustainable funding streams, and we're going to be working with the state legislature to ensure that we get those. So are guns more accessible today than they've been in the past? Absolutely. As has been discussed, the rates of gun violence have gone up since 2020. And what many of you may know is that the rates of gun ownership have also gone up since 2020. A lot of states around us, Indiana and Iowa, have been limiting their laws. They've been taking laws away that would promote gun safety. And unfortunately, Wisconsin has really done nothing over the last decade to reduce gun violence. So as Tara explained, our rates of violence have gone way up. So what should we do? As I mentioned before, there are so many policies that we need to be putting in place. But I think first and foremost, some of the most important policies for this session are to pass a universal background check bill, adopt an extreme risk law, invest in the CVI programs that are working in the state right now, and strengthen our child access prevention law. This is just an overview of where our laws are, and Giffords is a national organization that does scorecards every year to rate how states are. Right now, we have a C because, again, we're lacking some of these very, very basic laws that we know save lives. These are some resources. If the slides get shared, they're great resources to look up these different policies and learn more about them. And then lastly, I have my name and contact information if anyone wants to contact me. So I'll be around for questions afterwards as well, but hopefully this was helpful to give kind of a quick overview of our policies and how we compare it to our neighbors. Thanks.
Yeah. Thank you so much, both Tara and Nick, on the startling findings of the gun death report in Wisconsin. And as Nick just mentioned, any questions that you have, please put them in the Q&A box, not the chat, and we'll address the questions for Tara, Nick, and our other presenters at the end of the program. So our next speaker is Ariel Smith, who is Director of the Policy Planning and Evaluation Division of Public Health, Madison and Dane County. She will address the topic of gun violence as a public health issue. Ariel provides strategic direction to the agency's prevention programs, policy efforts, and evaluation initiatives. She is responsible for developing and maintaining a broad strategy for how the agency will advance health policies and build diverse partnerships. Ariel played a key role in the creation of the county's comprehensive violence prevention plan, with the goal of increasing collaboration and coordination among violence prevention and intervention service providers. Ariel holds a master's in public health from American Public University and a BS from Gannon University. Welcome, Ariel.
Thank you so much, and thank you for having me. A little different than my colleagues before me. I don't have a fancy PowerPoint for you. For me in my role, I find it a lot better for me to just talk about public health and how I see gun violence as a public health issue. And I think that narrative and that term can sometimes be very confusing to people, because I think when we think public health, we think communicable diseases coming off of COVID. That's definitely been at the forefront of people's minds, but public health issues are so much broader than that. They're really anything that can impact the health, safety, or well-being of our community. And when we talk about gun violence, we really have to think about, in the prevention realm, that this is also something that can be prevented. Gun violence is not just about individual engagers. It's not just about the direct people that it impacts. It truly is a public health issue and public health crisis that devastates entire communities. And so when we talk about that, when we think about the ways in which gun violence extends beyond the individual or individuals who are impacted, it leaves families grieving, communities grieving, sometimes fearful around safety. It can leave neighborhoods and individual families struggling economically. And it can really have just an overall impact on the safe, healthy and well-being of our communities. I think a lot of times as public health professionals, we recognize gun violence as a public health issue, but I don't think we talk about it enough the way we talk about infectious diseases, right? Because the same way we talk about infectious diseases being preventable is the same way we need to start talking about or continue talking about injury and violence also being preventable. And so when we talk about it being a public health approach, that really means that, one, it has the ability to be prevented, and two, it means that through prevention, we are talking about addressing root causes, not just trying to put a cap or a solution on the end of the problem, but really trying to prevent the problem from starting in the first place. Public health issues and a public health approach also means that we have to invest in community-based solutions like violence prevention and intervention programs. We have to ensure that we have increased access to mental health support. We also have to acknowledge the role that social determinants of health, which is a very public healthy jargon phrase, that really just means when we're talking about poverty, education, access to resources, all of those things have to be improved upon or sustained because they have such an impact on how we see violence patterns. And so in Wisconsin specifically, we know that we are falling behind, right? My colleagues before me talked about the data that we're seeing in Wisconsin. We've talked about how we are tracking compared to states that surround us and also national trends. I mean, I don't know about you all, but when I was in school, a C was kind of barely making it by. We're so much better than that in Wisconsin. We don't have to be barely making it by. We can truly get to a better place with increases and advocacy for different policies and practices to help reduce what we're seeing in terms of violence patterns in our state. And especially here in Dane County, we have a lot of opportunity. I think the other thing that we talk about with public health issues is the financial toll. And I don't mean the individual one, but truly kind of like what the cost is to our society. And with gun violence, Wisconsinites, we spend about $9 billion annually by not investing differently in prevention and intervention strategies. It just gives us such an opportunity to do something different. And so again, when we talk about public health approaches, that really means getting to the root of the problems from a policy, systems, and environmental lens and addressing those opportunities first as kind of the first step in preventing further gun violence. I think from my perspective as a public health practitioner, one of the things I hear quite a bit when we talk about gun deaths are the ones that are as a result of homicide. And while I think that's incredibly important, especially when I think about the team that are about the work that our team at Public Health Madison-Dane County does, it does give me a little bit of pause because I don't think we can talk about gun violence in our community without acknowledging the gun-related deaths that are attributed to from suicide. And in Wisconsin, the number is staggeringly high. I believe that suicides account for 70% of all firearm deaths, with nearly half of all suicides involving a gun. And so when we think about how we even talk about gun violence, we really need to, and public health has specifically invested in making sure that people have the data and information correct when they're speaking about it, and make sure that everybody understands what the facts are and what the data is around what we're seeing here. And so I think when we think about that framing, right, not just being so focused on what homicidal death looks like, but really looking at gun-related deaths, including self-harm and suicide, it just really lends to the idea around how we have to start strengthening mental health services and accessibility, especially in rural and underserved areas. Adopting evidence-based policies. I know Nick talked a little bit about extreme risk protection orders, sometimes also known as red flag laws. As Nick mentioned, we don't currently have such a law in place, but we have seen such success in that with other states that we know that implementing one could be really impactful and save lives. Additionally, another thing that we do here at Public Health and we talk a lot about is a concept called harm reduction. And what does that mean for folks who are maybe not ready to take some bigger next steps, right? And so one of the important harm reduction practices when it comes to gun violence is safe storage. Opportunities for safe storage laws, gun shop partners who will help support safe storage for individuals who own firearms when they may be recognized that having a firearm in their home for whatever reason is maybe not the best thing for them right now. And public awareness campaigns that help to reduce the stigma around that from both sides. I think we talk a lot about the stigma around gun ownership, but we don't talk a lot about the stigma between gun owners who then feel like they can't turn over their firearm because that's just, not within the culture. And so, there's a lot of work being done behind the scenes to think about what better harm reduction type practices like safe storage and even impulsive firearm access and reducing that to the best of our ability can really look like. I think one of the things that Tara talked about that also comes up for us quite a bit when we think about this as a public health issue is the racial disparities. We know that it disproportionately affects Black Wisconsinites. And that has a very complex history, which we don't have a ton of time for today. But as it was acknowledged in previous presentations, that combination of historical, social, systemic, economic factors kind of woven throughout the history of Wisconsin have really lended itself to why we see some of these disproportionate rates in gun violence. I think at the same time, when we also couple that with aggressive policing in some cases, and then under protection around safety and what that looks like, it's kind of cultivated this environment that has become pretty ripe for conditions of not always feeling safe, maybe feeling the need to overprotect yourself or kind of overly be prepared to protect yourself. And again, it's led to just kind of a widespread, I would say a widespread feelings of community trust in, or I would say maybe community mistrust in a lot of different areas around Wisconsin. I think it's also, though, important, as much as we're talking about Wisconsin and Dane County, we know this isn't just a Wisconsin issue, right? Like this issue is not only seen nationwide, but like we just see it in a lot of different populations. And I think it's important for me to name that while contextualized, gun violence does look and affect people of all different backgrounds, all different races, all different socioeconomic statuses very differently. And so I also kind of shy away from trying to make it a bigger category, because I think it's important to acknowledge the nuances in how it impacts different people depending on those racial and social factors and their intersections. Because it's really hard to talk about gun violence if you're not thinking about those nuances and those specificities. One myth, I think, or a question that I get quite a bit, especially in today's kind of climate around gun ownership and gun violence, is often kind of this argument of like, isn't the best defense of somebody who has a gun with another gun? And I think in reality, it's not that simple. I think it's important to remember that none of us are defined by our worst moments. And many who commit gun violence or participate in many forms of violence have also been victims themselves. And so from a research perspective, it consistently shows that access to more guns leads to more violence, not necessarily less. And I think that's important for people to hear, because the narratives can sometimes be so strong that, you know, a gun can only be fought with a gun. But I think from my public health view, I think gun violence is so much more than just the means in which it's perpetrated. We have to start thinking about the bigger challenges. I've mentioned mental health, the social determinants of health, the bigger social policy, economic factors that lend to creating an environment where violence has arguably kind of just been accepted as a thing that happens in our society, especially in America, for 400 plus years. It's going to take quite a while for us to unlearn those behaviors and patterns and to build a culture that no longer accepts that. And violence in any way, shape, or form, to be honest. I think a lot of times too, when I'm talking about this, this idea of, you know, can more guns kind of help to promote safety against gun violence? I think it's also important to recognize too, from a data standpoint, that there's very few instances, especially when we think about mass violent incidences, where armed civilians have actually been able to stop active shooters. And so again, just like trying to really infuse facts and data with folks so that the understanding of more guns, more access to firearms, even with the intent to stop maybe somebody who's planning to use it for malicious purposes, often doesn't actually end up that way. Instead, like I said, we really feel that the focus should be on prevention. Stronger background checks. We talk a lot about that. We talk a lot about mental health screenings, maybe a few more inquiries into maybe why somebody's planning to purchase or gain access to a firearm. Safe storage, I can't say that enough. And then other community-driven solutions, right? Rather than maybe encouraging people to just carry one for carrying one's sake. Being a gun owner is something that no one should take lightly, and really needs to be done with the most safety and care possible. I think one of the things I also just want to recognize that's changed recently with our landscape here in Wisconsin in terms of violence prevention is the establishment of offices of violence prevention, both recently at the state level. Governor Evers established the Wisconsin Office of Violence Prevention, and that is definitely a step in the right direction. And also at the local level, I believe by my count, we have 5 kind of de facto offices of violence prevention around the state. Milwaukee, Racine, Green Bay, Kenosha, and then ourselves at Public Health Madison, Dane County. And I just can't express enough that I believe with the right investment in violence prevention and intervention programs that we can lead the way in reducing gun violence and saving lives, and ultimately get to our goals around reducing violence in our communities and taking those very specific community-driven approaches to what that should and could look like. I can say with experience being our director over our violence prevention unit, one of the things that happens for us quite a bit, especially here in Madison, and can't be helped, we're compared to Milwaukee quite a bit. And we love our Milwaukee colleagues in the Office of Violence Prevention and in 414 Life that operate out of the hospital systems. But our demographics look very different. Our social structures look very different. Our approaches, and because of that, our approaches to reducing gun violence in our communities also look different, and that's okay. But I do think having the support and just camaraderie of other offices, what I would hope to see in the state office is just more of that bringing us all together for our common mission of reducing gun violence around Wisconsin. And so, yeah, just to wrap things up, gun violence isn't just a criminal issue. It is a public health emergency that requires all of the solutions. And I appreciate you all taking the time to hear more about that today.
Well, thank you so much, Ariel, and we really appreciate gaining a better understanding of the effect of gun violence on the health of our society here in Wisconsin as a whole. And I think there was a link put up in the chat to the Office of Gun Prevention or Violence Prevention that Governor Evers has established, so we can find out more information about that. So again, if you have questions, and I see many of you are putting questions in the Q&A box, that's what you should do. And we'll address those at the conclusion of our program. And our final segment is coming up right now. And it responds to the question, what can be done locally to address the issue of gun violence? Our speaker is Lindsay Busher, volunteer legislative lead for the Wisconsin chapter of Moms Demand Action. Lindsay has held leadership positions with Moms Demand Action in Madison and statewide since 2018. Her current focus is working with gun sense legislators and like-minded organizations such as WAVE to help advance gun safety legislation. Lindsay, welcome.
Thank you, Carol, and thank you, everybody, with League of Women Voters for having me here this evening. I also don't have any slides. I'm not good with slides, so I'll just be talking, although I do actually have one slide. And if you could put up the first slide. So as Carol said, I'm Lindsay Busher. I'm the state legislative lead, as well as, and I should have sent this to you, Carol, I'm sorry. I am also now the Demand a Seat recruitment lead, which is a new position with Moms Demand Action, which I'll talk more about in just a second. I'm a mom to 2 young boys. 7 years ago, last month, actually, on Valentine's Day, my kids were 4 and 1, and like everybody else, we saw the news coming in about mass shooting at the high school in Parkland, Florida. And I'd already been glued to the TV in 2012 when Sandy Hook happened, but that was before I even had kids. So like I knew when Parkland happened, I had to get off the sidelines. I had to do something. And I didn't want to wait for gun violence to come to my doorstep. Like so many volunteers. It's a very similar story for so many thousands of volunteers across the country. So I found Moms Demand Action. So for anyone who's unfamiliar with the organization, Moms Demand Action is a grassroots movement fighting for public safety measures that can protect people from gun violence in America. We advocate for common sense gun laws, educate on secure storage and suicide prevention, and we work in communities all across the country to partner with organizations who are already on the ground doing the work with survivors of gun violence and doing the life-saving work to prevent it. So like Ariel said, one of our partners is the Office of Violence Prevention, or the Public Health Department Gun Violence Prevention Coalition. So they're one of the organizations that we do a lot of work with. So it's really great to see you here tonight, Ariel. So anyway, one of the other things that Moms Demand Action recently started doing, they developed this program called Demand a Seat. And it's a training program for volunteers, and it's free. And it trains people how to run for office or how to run a campaign. So if anybody is interested in learning more about that program, please let me know in the chat and I will be in touch with you. So some of you, when you see news and headlines about shootings and you ask yourself, what can I'm just one person, what can I as an individual do to reduce gun violence? And I think the first thing you have to do is avoid getting overwhelmed, because there are so many things in these chaotic times demanding everybody's attention. And just recognizing that if you are one person and you're holding, I'm a knitter and a crocheter, so I like to think in terms of like yarn. If you're holding one piece of yarn and you're really good at something, and everybody else around you is holding another piece of yarn and doing their one thing really well, then you can work together and knit or crochet it together. And when you're each focusing on your strengths, but working together as a community, then we can make something amazing and beautiful and really strong. So the thing that I have learned the most over the last few years, I think, is working together is a big strength. And it's a thing that people don't think about a lot. So joining an established organization like Moms Demand Action gives you the power of the entire, infrastructure to implement changes. So I know a lot of you are probably, you volunteer with a lot of different other things. And this is just one more thing that a lot of us are out here working, and the more people we have in this movement doing the work, the easier it is for each individual person. So if you're interested, oh wait, can you go back a slide? Is there a different slide? Anne?
Yep.
That's okay. There we go. So if you are interested in joining Moms Demand Action, you can either text JOIN, JOIN, to 64433, or the best thing you can do is scan one of these QR codes and download the Demand Action app. It will have all of our events coming up, and there's a lot of great discussions on there, and there's a lot of great news if you like to get news in a certain way. So the app is a really great way to learn more about and get more access to taking action with Moms Demand Action specifically. Another thing that we like to tell people to do is to get to know your state and federal and local elected officials. So one of the things, if you don't know who your state, since we're in Wisconsin, if you don't know who your state representatives are, your senator and your assembly person, you can go to, I should be putting this in the chat, I'm sorry, Anne, legis, legis.wisconsin.gov. And you can enter your address in there and find out who your legislators are. And if you click on the more information, it'll take you to like your legislators page, and they'll have somewhere on their page, they'll have something where you can sign up for their, thank you, Melissa. You can sign up for their email updates. And this is a really, really great way to keep an eye on what your legislators are doing, how they're voting, what they're paying attention to in the legislature. And also right now, the biggest thing is a lot of them are starting to schedule like meetups or like coffee with a legislator or listening sessions for the budget, because the budget was just introduced a couple weeks ago. And so now all of the legislators are scheduling these listening sessions so that they can find out from their constituents what matters most to them. And this is a really, really important way to have like one-on-one conversations with your legislators. You know, just getting to know faces goes such a long way for legislators. And having worked with legislators for the last several years, I know how important FaceTime is with them. So the more they get to know you and the things that you care about, and if you tell them like gun violence prevention is a really key issue for me, and I, you know, ask them what they plan to do about it, or will you support a specific bill when one comes up. And like Nick talked a lot about different bills that we hope to see here in Wisconsin. So like some of the things, you know, like he mentioned, and everybody has mentioned, like background checks, extreme risk protection orders. Another one that we really want to see at least get introduced and at least get a hearing is to not allow firearm possession for misdemeanor domestic abusers. We would also, you know, there's so many other things that the governor has even proposed, like reinstating the 48-hour waiting period, that would be really helpful. So there are plenty of things, you know, if you just kind of keep an eye out for bills when they get introduced, or when like when the governor included all of these really amazing things in his budget. Get in touch with your legislators and just really, like, every day if you want to, you know, the more they hear from constituents, the more they have to pay attention. So really, really keeping close tabs on your legislators, which I know a lot of us don't have a whole lot of time to do. Even if you do it just once a week, once a month, you know, just having a little bit of contact with your legislators can really go a long way. There are some laws that are already in place in Wisconsin, shockingly, that have been proven to reduce gun violence. So it's not totally all bad news. A few of the things that we do have, we do require a permit for concealed carry. And we do not have a shoot first law, which is good. That's also, a lot of people refer to that as a stand your ground law. So we don't have that, which is positive. We do not allow guns in K-12 schools, but Republicans in the legislature are currently trying to dismantle that with a bill. So let your legislators know, please don't support that bill. Secure storage requirements are currently in place in households with children under 14, but we really need, I think Nick and Tara mentioned, like, we need to make that law stronger, the child access prevention law. We need to raise the age to 18 at least, and make it, there's a lot of things that can be done to make it a lot stronger. And as Ariel mentioned, we have the new Office of Violence Prevention that Governor Evers announced in January. And he included it in his proposed budget, and they're going to be hiring for the director of that office very soon, which is super exciting. So there are some good things that are happening around Wisconsin despite everything. I will say a lot of the things were dismantled during the Scott Walker era. So it's taking a long time to fix some of the things that he dismantled. But we're working really hard to get our legislators to do the things that are necessary. So as a volunteer activist, one of the things that I hear a lot in conversations is people blaming gun violence on mental illness. And the only thing I can say to that is every state and every country has people with mental health issues. And yes, mental health absolutely must be addressed and should be covered by insurance companies as part of the health of every human being. But gun violence is not a result of mental illness or a mental health crisis. And linking the two it only worsens the stigma around mental health. So in fact, people with mental illness are actually more likely to be a victim of gun violence than a perpetrator. And really the only key factor is access to firearms. It's the guns. So there are, we talked about background checks and extreme risk protection orders that can keep guns out of the hands of people who are a danger to themselves or others. There's other laws that Wisconsin could consider that some of which have been introduced in the past and have gone nowhere, like raising the age to purchase a firearm to 21. Currently it's 18. We need to regulate open carry, like not allowing guns on college campuses or in bars, which is currently legal. And currently anyone over 18 can open carry anywhere without a permit. We could and should prohibit assault style rifles and bump stocks and ghost guns like states around us are starting to do, like Nick was talking about. We need to require dealers to have a license. We don't even require dealers to have licenses in Wisconsin. So there's some very basic things that we as voters need to be advocating for. So question I also get, it's easy access to guns. Yes, absolutely. A question I get a lot too is like at the federal level. So like we've been talking a lot about stuff at the state level. What might be going on at the federal level that could be helping at the state level too. So we need a federal extreme risk protection order. We need federal background checks, just like we do at the state level, and they have to both be in place so that they can help each other. I will say we currently have one bill that we are trying really hard at the federal level to stop right now, and that is HR 38, which is called the concealed carry mandate, but we call it the concealed carry reciprocity because it's actually, it means that anybody in another state with a weaker law can take a gun into any other state, and that other state has to honor the weaker state's laws. So someone from Florida could come to Wisconsin and they might not have a concealed carry permit like we do in Wisconsin, but they could take a hidden loaded gun into any building in Wisconsin. And if anything happened, they would be protected by this law if it passed. So we're really trying to make sure that our federal legislators and people in Congress do not vote for or support HR 38. I probably could have had some slides about that, but I didn't, sorry. So as voters and as constituents, we do have the power to make changes happen. And we at Moms Demand Action believe in taking action. So here's the last, Anne, could you go to the next slide, please? This QR code will take you to a list of all of our upcoming Moms Demand Action events if you are ready to join us and get going. We've got a lot of canvases for the upcoming election on April 1st, a lot of postcard parties. You can send postcards to voters. A lot of the things that League of Women Voters, probably you all do already, which is really great. We all have the same common goal, which is fantastic. And then a really big thing is attending the in-district budget listening sessions with legislators. So I've got a few events posted up there. There'll be more across the state coming up over the next few weeks. So that's all I have, Carol.
Hey, well, thank you so much, Lindsay. And today is kind of a breaking news day because I know that the Dane County Board of Supervisors is actually, they may be voting on it right now, a resolution on demanding more gun sense legislation by our state legislators. Now, this webinar is put on by the League of Women Voters of Dane County, so we're really interested in what's going on at a Dane County level, and I understand you attended the meeting this morning. So can you briefly, because we've got a lot of questions and I want to get to as many as possible, just explain a little bit. I think they're zeroing in on a few things that they're going to try to get done instead of do it all and anything.
Yes, I was very honored to be at the press conference this morning at the Capitol when they introduced this resolution here in Dane County. So they want to do just very basic things at the county level because they know that legislators at the state level have not been even entertaining, not even talking about any gun sense legislation. So they want to at least make it possible so that there's this tricky law in place that needs to be repealed, first of all, so that if the state is not passing laws, then it will give power to the local authorities to pass their own rules about things like public safety. So extreme risk protection orders and background checks and child access prevention are like some of the biggest things in this resolution that the Dane County Board of Supervisors wants to be able to implement themselves. So we were so grateful for the board for introducing this resolution and just trying to do anything at any level to protect Wisconsinites. So yeah, it's been a very exciting day and they are voting on it like right now as we speak.
Very exciting. And they're looking at those three laws, the universal background check, the red flag laws, and then the gun safety storage, and just sticking with that right now. So stay tuned, everyone. So let me get to the questions because we have so many of them and see if I can group some of them. One question, and and this would be Tara and Nick, I think you can address this. Do you have an explanation for the differences between urban and rural suicide rates? And then there was also a second question for Tara to explain the screen that shows the 6.3 of the Wisconsin population identified as Black, but then this high percentage, I think it was 75%, the proportion of Wisconsin homicide victims are Black. So there's two levels of disparity here, rural, urban, and the high rate of homicides in the Black population.
Yeah. Thanks, Carol. And thanks for asking those questions. So to address the first question about sort of the urban-rural divide and firearm suicide rates, we know that when guns are more accessible, the risk of firearm suicide is higher. In rural areas of the state, there are a lot of hunters with easy access to guns, right? And so this access makes suicide attempts just a lot more lethal. And then I wanted to, let me see if I can share my screen again to show the firearm homicide disparity and explain that.
Are we talking enough about suicides? That was one of the questions. We talk about gun violence and we're thinking of shootings like in the Abundant Life Christian School, but are we talking enough about suicide and the great threat and the rise in that?
Yeah, that's a good question. Let me go ahead and answer this question about the pie chart graph, and then I think I might pass that question along to Nick if that's okay, or if one of the other panelists wants to answer that. So I believe the question was about these two pie charts showing the differences between the Black percentage of the population in Wisconsin and the percentage of firearm homicide victims in the state. So Of course, Black, non-Hispanic Wisconsinites make up a minority of the Wisconsin population. It's a very white state. And so in a theoretical situation, if firearm homicide were to impact all of the populations relatively equally, we would expect the percentage of firearm homicide victims, so this pie chart here, to look really similar to the pie chart on the left. We would expect only a small percentage of firearm homicide victims to be Black, something around like 6%. So the fact that 3/4 of the firearm homicide victims in Wisconsin are Black just really highlights how much of a racial disparity exists. So thanks for letting me share this slide.
Okay, and then it was regarding the suicides, and are we giving enough attention to that? And maybe you can address that, Nick and Ariel. That is also a public health issue.
Yeah, I mean, I can answer that, and it kind of depends on what you mean by we. And honestly, the answer across the board is probably no, we're not doing enough. But certainly,
Yeah.
I think,
So-
when you're talking about the media, absolutely not. They're not covering the issue of suicide and suicide prevention nearly enough. What draws most of the media attention are mass shootings, and that means that suicides are ignored. That means that violence that happens in communities across the state, everyday violence that occurs, community violence, is ignored. Domestic violence and issues in the home are ignored. So certainly the media has failed in that regard. Most politicians, and I don't want to paint with a broad brush with any of this, but most politicians have failed in that too. I think that it's so easy to try to win political talking points by pointing at a mass shooting, and that as tragic as they are, they're still so much more rare than suicides and community violence and other forms of gun violence. So often when they're talking about gun violence, they're talking about mass shootings and mass violence. And then as activists, I think that we're trying to point to the issues and be more holistic in our approach, but I'll admit that we could do better with that too. I think a lot of people who care very deeply about the issue are motivated to join the movement based off mass shootings, and that's totally understandable. That's what we're being shown through the media. But I think if we get into the movement and you start to realize that this issue is so much bigger than just that, it's important that we, as activists, look at it from a more holistic perspective too. So we've been talking to legislators about the need for suicide prevention policies. And I think those conversations have been more and more fruitful lately. But time will tell if it leads to anything. And I'll pass it to Ariel if you have anything to add, Ariel.
Respond to that. And I once heard that sometimes if just the access to a gun, the fact there are guns available, with somebody who gets in great despair and wants to commit suicide, the gun is so permanent and they can't change their minds. And if that gun weren't there, even a little bit of time, some people can actually change their minds and don't do it.
Which is a really strong argument for the reinstating the waiting period, right? Which is 48 hours probably isn't the best amount of time. Research shows it should be longer than that. But we had a 48-hour waiting period in the past, and I think at least returning to that at the bare minimum would be a life-saving policy. So, yeah.
Ariel, do you have any comment regarding this as a public health issue?
Yeah, I think what Nick said is spot on, right? As much media attention specifically that mass violence gets, I think it's really important to remember that mass violent incidences are kind of the exception and not the norm in most communities around our country. Those are kind of the outliers and the atypical. It's the community-based violence. It's the family and domestic-based violence that runs, and sexual-based violence that runs to so frequent in our communities. And I think to an extent, I feel like we've almost become like desensitized to that. And I think that's part of why it gets skated over so much. But because mass violence is the outlier, it gets so much attention. And I think Nick is spot on with, like, we have to do better about that, because just because it happens more frequently does not mean we have to accept it as the norm. And I think that's something we in public health are really working to do and change changes our societal norm of like no form of violence should ever be acceptable. Like we should never hear that and think, oh, just another day, another time it happened. That should never be the norm.
Don't almost 80% of the victims know their perpetrator?
That is correct. Yes, most people who have been either a victim or an engager know the person or people who were also involved. And that goes across all forms of violence.
And there's one question, since you're on, is the $9 billion cost of gun violence, is that a state or a national statistic?
That is a state level statistic. So that includes like the injury costs related to like hospital stays, the law enforcement response piece, sometimes other like criminal justice type pieces that get involved. That is how much it truly costs us on an annual basis. I think that's an annual. I'm pretty sure that was an annual statistic. I can go back and verify that for what it costs to respond to gun violence in our state.
I know that's suicide and shootings. Yeah.
Yep,
Okay. And then
all gun violence.
a couple of questions regarding the increase, the dramatic increase in the sale of guns and the purchase of guns. It happened in, I think the statistics started to rise in 2020. Is that because of the pandemic, or is there some other motivating factor that has increased the sale of guns? Nick, I think that was Nick or Tara, that was part of your.
Yeah, I mean, I think that if anyone has more to add to this, happy to hear more thoughts. But my understanding is that it's a kind of a bunch of factors all in at once. There was with the pandemic, there was just a lot of concerns about, I mean, some people had concerns about government overreach, and there's just so many different things that may have led people to feel unsafe at that time. And whether or not those feelings were justified, the gun lobby saw they were there and really tried to capitalize in the moment and realized people felt unsafe and insecure about their future. It was during a presidential election, which always raises some concerns for the country. And instead of, doing what would be right and not trying to get involved, the gun lobby capitalized in that moment and really pushed out their messaging, which led to a higher rates of gun violence or gun purchases, and then gun violence after that. But yeah, if anyone else has more to that, I mean, that's my understanding, but I think it's complicated for sure.
We looked into this a little bit because during 2020 was when we started creating our roadmap to reducing violence, which is our community-based strategic plan for reducing violence in Madison and Dane County. And we had some anecdotal information that was exactly what you said, Nick, of like a little bit of presidential election, a little bit of like uncertainty, people just feeling they need to do something to make them feel safe. We also heard a lot of scarcity mindset. There was quite a bit of fear or fear mongering, it sounds like, around guns might get taken away. So kind of like get them all while you can. And then we also recognized an interesting economic factor, which was ammunition prices were down, like statistically lower than they had been in the past. Not really sure what contributed to that, but we did recognize again anecdotally that was some information that we were getting to. So that's what we saw around this.
There are a couple of questions relating to not gun deaths, but people who are injured. And so the statistics are pointing out to the homicides that occurred or the deaths that occurred. What about people who are injured by guns, either through their own self-inflicted wounds or in shooting incidents? Who would have some information about that?
I feel like I'm talking a lot, but our office does a lot. So this is good if my fellow panelists don't mind. I know Nick and Lindsay are used to this from me. Yeah, we track injury as a part of kind of our normal health department functions. I think one of the reasons, at least from our perspective, we tend to talk a little bit more around fatality versus injury is one, the data can often be flawed. It just kind of depends on what's being coded at a hospital or health system. And it's also making an assumption that somebody who was injured by a firearm is reporting to a health system, since that's how we get our primary forms of data. And so for us, it just tends to not be the most reliable data point or indicator when we talk about gun violence. But that being said, when we talk about like suicidality specifically, we tend to couple that with also self-harm, because those two kind of go hand in hand in the ways in which we look at violence and injury as a health department. So I would say that's kind of why we specifically, not that we don't talk about it, but it doesn't tend to be the most reliable indicator or data point when we're trying to get understanding around the total impacts of firearm violence in our community. Just kind of depends on what we're talking about, where it might be most relevant or helpful.
But those injuries raise the numbers and they're already startling. So,
Yes.
okay, I'm going to keep you on, Ariel, because I have one specific question for you. And I think it's really an important one considering we're Dane County here, the League of Women Voters, and we're focusing on Dane County, but it is a state and national issue as well. But what exactly is Dane County and the Madison Public Health Division that you're a part of doing to decrease gun violence? What specific programs do you have or do you want to adopt and need for approval in the 2026 budget?
Gosh, okay. So what do we currently do? So my office, our violence prevention unit, we have two branches, as I call it. We have our violence prevention branch and we have our violence intervention branch. So our prevention branch works on some of those bigger policy systems and environmental changes that we talked about, related to, like I said, like the policy aspects. So some work with like WAVE and Lindsay and folks on our team have gotten a chance to connect with that. We also look a lot at like built environment and design. There's a lot of things that we have learned around well-lit areas or like access points that kind of create breeding grounds for violence that we've been able to help inform like planning divisions with the city and the county to modify these things in order to reduce the opportunity for violent crimes to occur, specifically firearm crimes, because that's what our unit is mostly focused on, but also other forms of violence as well. We also facilitate a group that comes together weekly to talk about violent incidences that have occurred in the county. That's called the Community Safety Intervention Team. And what we do is we review and debrief pretty much every single violent incident related to a firearm that has happened in the county within the past week. And from there, we information share with entities like law enforcement, social service entities, our health department, and quite a few other partners, and create action plans and strategies to, one, support any victims who maybe were involved in that violent incident, but really in order to prevent any further incidences of violence. And so that's also where our violence intervention team often intersects, and they work with anybody who has been involved in a violent incident. And so I know that sounds vague, but bear with me. They work with both engagers of violence, which often is synonymous with perpetrators of violence, but we choose the term engagers, and also victims. So we run the gambit on both sides of that spectrum. And the goal of working with individuals who have been involved in violence is in order to support recovery from whatever violent incident they were a part of, and or reduce and eliminate risky behaviors that somebody may be participating in that have been flagged as indicators for high likelihood of engaging in violence. And so we really work hard to identify who those folks are in our community, to get in contact with them, to offer support, often support behavior change, talk about what diffusing conflict could look like apart from picking up a firearm. We talk a lot about any mental health challenges. We talk about the normal like societal challenges of like why somebody might be engaging in violence, again, either as the engager or sometimes being consistently victimized of violence, because as we know, often it's a cyclical process. People who are engaging in violence are often have been victims in the past, and sometimes victims then become engagers. And so what we really try to do is break that cycle by utilizing both of the branches of our team. So I could spend all day talking about all the things that our team does. If anybody has any specific questions or wants to know more, our roadmap, which I believe the link was put in the chat, is a really great resource. Also, feel free to email us or call us anytime. We love fielding questions about what we do, because we know not enough people know about us and what we do.
The big event that made national news and for quite a while was the shooting at the Abundant Life Christian School. Obviously, you must have been notified immediately and and got involved actively. What did you do there? Give us an example of how you were an intervention resource.
Yeah, great question. So yes, we were notified pretty much immediately. And what we did was our team deployed directly to the reunification center to support the kids who were there originally, and then the reunification that happens with the parents. And then from there, our team transitioned into what is kind of their normal day-to-day role, which is unfortunate, which is helping people recover from the violent incident that they just occurred. And so that started with really trying to work with anybody who was directly injured, or any families of the deceased, unfortunately. And then we branched out from there from anybody who might have been in the school that day. We worked with a lot of parents who whose children were experiencing some adverse trauma type responses, especially during the time where like the school was closed, and tried to really support both resources that can run the gamut, whether it was housing, positive youth development type activities, different childcare structures, supporting some opportunities for trauma-based assessments to be done for parents who were really concerned and just really wanted like a little bit of a mental health checkup for their kids. And so even today, that work is continuing. One of the things that was different for us responding to the Abundant Life school shooting is definitely having to plan for a longer term intervention than we usually do. Just knowing that the impacts of this affected so many people and at a magnitude to which our team was not originally built or equipped to do. But I have such an amazing team. I can't be thankful enough for the people I get to work with every day, who really have just worked to make sure that we can provide what we can for everybody who's impacted.
Lindsay, did that event create an opportunity for you to have more impactful discussions with legislators? I mean, obviously, it was national news and it got their attention. And did that open the door a little wider for a conversation?
We always hate to say it, but yes, it did create the opportunity, and we hate having to take advantage of opportunities in that way, but it absolutely did. It happened in our backyard, and how can you not talk about it when it's happening in your own city? And things like this don't happen a whole lot in Madison. And so it was a very shocking event for everybody. And
Were they
a
more
lot,
receptive to the discussion as a result of that?
exactly. Yeah. A lot of alder people were really open to having discussions. A lot of representatives and senators, especially in Madison, have been like really on top of things, and being more proactive, I think, than they normally had been in the past. So, and especially with, can I just say the breaking news, the really exciting breaking news, the resolution just passed.
Oh, well,
So like even the county,
news.
yeah, the county board really took to heart what the impact has been on the community, and they did something about it, and it passed. So I'm very excited.
So, let's follow up on that. What happens next? Do they take that resolution to the state legislature? Because actually it's against Wisconsin law for communities, counties or cities or small communities to have separate gun violence or ordinances or resolutions.
Exactly. Yeah, I think, Nick, you can probably speak more eloquently to this, but I think it will go to legislators will have to introduce a resolution, or not a resolution, an amendment to that law, to overturn the law first. And so I think that's the next step. Is that right, Nick? Does that sound right to you?
Yeah, so I mean, the law that we're talking about is a state preemption law that has been said essentially tells localities that they can't regulate guns or do anything that the state hasn't already legislated on. So when a city like Madison or a county passes a resolution like this, it's largely just a message to the legislature that, we
No.
think you need to take action on this. But it's more than just symbolic. I mean, there are things, and I haven't looked exactly at this resolution in detail yet, but there are some things that cities can do that we think would make a big difference, but they're more limited in scope than we wish they were allowed to be. But I think this is a strong message to the state legislature that this is an issue that Madison cares about, Dane County cares about, and certainly we know other areas across the state care deeply about too.
This had to get passed as a first step. And I noticed that the legislation is for universal background checks, the red flags, and the gun storage. And so that's what they're focusing on. It's almost time to end, but I'm going to ask one final question of you because people want to know what to do and act, what you had said, contact your legislators and be active and have a voice. But you've shared a lot of policy changes we can support to reduce gun violence. Please give us steps we can take in our communities to build a culture that does not love guns. And I open it up to each of you to just make a final statement on what you think, one thing or two things that we each could do.
The best thing you can do is talk to your neighbors, talk to your family members, have the conversations with your friends, the people who and who trust your opinions on things, and just express the deep frustration you have around the culture of just such prevalent gun ownership, and just having one-on-one conversations truly is the best. In the election world, we call it relational canvassing, just talking one-on-one with the people and letting them know how upsetting it is that this is the way that this country is right now.
Okay, Tara, thank you.
Yeah, I would agree with everything that Lindsay just said. I think that, reaching out to friends, family, neighbors, and having open and honest discussions is really important, and one way we can move the needle on this.
Nick, would it be important to focus on what the resolution is focusing on? So you've got specific legislation that you're talking about?
Absolutely. So we're really excited about the work that the Wisconsin Gun Violence Prevention Coalition is doing. It's made up of groups around the state and really around the country that are doing work in the state. We have our own list of policy priorities, and we're having our first day of action on May 20th. So I'm going to put my email in the chat, and everything that everyone else is saying is great. Have these conversations, but also we're going to give you an opportunity to talk to your legislators. And then I want to plug too that Moms Demand Action is doing a day that's also in partnership with the coalition on October 21st. So there are actually going to be opportunities to get more involved with legislation and advocacy. So I'll put my email in the chat, and please reach out if you want to get involved. Also go to WAVE's website or Mom's website or any other website that does this work, and try to find ways to get involved that way.
Right, and on the, I think the information on the website and the chat, we have all of your contact information, so the conversation can continue with any of you. And if you want to take action and something specific that is actually going to make a difference. We have come to an end of our virtual forum on responsible gun laws and policies for Wisconsin. But before we conclude, I just want to thank League member and volunteer Ann Lacey for her behind-the-scenes technical support. My goodness, you've been wonderful, Ann. And a special thank you again to our expert speakers. Tara Weens, Public Health Analyst at the Violence Prevention Policy Center, Nick Matuszewski, Associate Executive Director of the WAVE Educational Fund, Ariel Smith, Director of the Policy, Planning, and Evaluation Division of Public Health, Madison and Dane County, and Lindsay Busher, Volunteer Legislative Lead for the Wisconsin chapter of Moms Demand Action. Together, you've given us a broad and valuable information on the impact of guns in Wisconsin, why gun violence is a major public health issue, and what is being done to advance gun safety legislation in Wisconsin. For more information on this critical topic, you'll find a link in the chat box to the dates and the times of follow-up discussion units, and we invite you to participate in those, and you'll also have a wonderful information-filled resource guide. On behalf of the League of Women Voters of Dane County, I thank you all for attending this virtual public forum. As a final reminder, make your plan now to vote in the next important Wisconsin election on April 1st. Remember, your vote is your voice in our democracy. Thank you and good night.